Welcome to this video about port safety. In this video, you will find information about daily checks you need to make of your child's line, what to do if there is a problem with your child's line, or if it is accidentally pulled out, and how to use your line safety pack. Throughout this video, we will refer to the patient as a child, but this will also apply to teenagers and young adults. We are going to demonstrate the safety aspects on our mannequin called Chester Chest. After watching this video, you will understand the importance of checking your child's port daily and what to do if it is accidentally pulled. You will also know what is in the line safety pack and how to use the contents if you need to. Your child will have their port inserted in theatre, and this is what it will look like. When the port has been inserted, a chamber will sit under their skin so the port will not be visible. They may have a bump on the chest where the port sits under the skin. When your child comes back from theatre, it is common that the port site can be bruised, but this will heal over the next few weeks. They will also have wound strips on their neck after the procedure. This is what we call the insertion site. These wound strips need to be kept dry for 48 hours and then will fall off naturally when they get wet. We would advise you to keep an eye on this site following the procedure for any signs of infection. The port needs a needle putting into it for us to be able to take blood samples and give medications. When the needle is in place, we call this accessed, and when the needle is removed, we call this de-accessed. When your child's port is accessed, it will look like this. You will see a needle, a line, a clamp, and a needle-free access device on the end. You may hear us call these smart sites or bungs. However, we will call them needle-free access devices throughout this video. The needles can stay in for up to 7 days, although they can be de-accessed sooner if they are not needed. When your child is at home and has their port accessed, it's important to be checking it daily. It is also important to ensure that the dressing stays stuck to the body and intact all the way around. If the dressing starts to peel, or if it comes off, then you can secure it as much as you can with one of the spare dressings in your line safety pack and call your community team or shared care hospital to attend for a dressing change. It is important to look out for signs that the line may be infected. These include redness around or tracking above the port, oozing, pain around or above the port, if it feels hot around the port, or if the child has a temperature. You should also check the insertion site on the neck for any of the same signs. If you notice any of these signs, you need to immediately let your community team or local shared care hospital know. You need to make sure that the clamp on the line remains closed at all times. If you find it is open, then close it and contact your community team or local shared care hospital for advice. There should be a needle-free access device on the end of the line at all times, and this needs to stay clean and dry. We will discuss what to do if this comes off shortly. If the port is not accessed, you still need to check the area where the port is for any signs of infection that we have already mentioned. If you want to give your child a bath, you can do so, but you will need to try and keep the line dry if the port is accessed. This is possible by filling the bath to waist height. To keep the end of the line dry, this can be put into a clean glove or a sandwich bag and secured with tape. It must then be taped up higher on the shoulder. This can all be removed after the wash. If the dressing gets wet, then contact your community team or local shared care hospital to arrange a dressing change as soon as possible. If the port is not accessed, your child can bath freely as long as it is at least 2 weeks post the insertion. For children in nappies, it's important to keep the end of the line away from the nappy area. Tucking the line away in a baby grow or a vest, or using a net vest or Surgifix is a good way of doing this, and also ensuring that they do not pull on or play with the line. If any wee or poo gets onto the end of the line, it is important to let your community team or local shared care hospital know immediately. For older children, teenagers and young adults, crop tops can be a good way of keeping the line tucked away. When you go home, you will be given a line safety pack. This contains the following: 2 needle-free access devices, 2 blue clamps, a pack of gauze, a large dressing, 2 small transparent dressings, 4 cleaning wipes provided by the hospital such as Clinell wipes, wound strips and medical tape. This pack needs to go everywhere with your child. If the needle-free access device comes off the end of the line, then make sure the clamp is closed. Wash your hands for 30 seconds and dry them. Take the cleaning wipe from the pack and clean the hub for 15 seconds. And then wait 30 seconds for it to dry. Open the new needle-free access device, take off the cap if necessary, and screw onto the end of the line. Be careful not to touch the tip of the needle-free access device or the end of the line, and make sure it is screwed on securely. If the line gets a hole in it or breaks, there is a risk of bleeding and infection. If you notice this, then you'll need to apply the blue clamps to the line between the hole or break and the needle. You might need to take off some of the dressing to be able to do this, but make sure the needle stays covered. To apply the clamps, take a piece of gauze, fold it in half, and then wrap around the line. Then put the clamp over this. Repeat this with the other clamp. Place one of the small dressings over the hole or break. If you need to secure the line further, you can use the large dressing or tape to secure the line to the chest to prevent further damage. You should contact your community team or local shared care hospital for advice as soon as possible. If the needle is accidentally pulled out, you will need to apply pressure on the port site if there is bleeding. It will then need reaccessing and flushing, so contact your local community team or shared care hospital as soon as possible for advice. Thank you for watching this film about port safety.